Hi, I'm Connie Franklin. I'm here with board certified plastic surgeon Anu Bajaj here in Oklahoma City. And we're going to talk a little bit about planning for surgery. What should patients know as like first steps planning for surgery?
Wow. So that can be a broad topic
Mm-hmm.
because there are multiple components to planning for surgery. One is you have to be emotionally ready to have surgery, right?
Oh,
Because
I'm so glad you
surgery
brought that up.
is going to change your body and you have to be understand that things are going to change. And part of being emotionally prepared also means that whether it's medications, anesthetics, the stress of surgery, your emotions are going to go like this all over the place
Mm-hmm.
before, during, and after surgery. And if you accept that that's going to happen, and if those around you know that that's going to happen, it's easier to accept.
And easier for them to support you through it. It's not just a big surprise
That's
to
true. And
everybody.
that brings up the other issue. Another thing when you're preparing for surgery is you need a good support system. And a good support system means someone who is going to aid you in the surgical preparation and recovery process, not someone who's going to criticize you along the way. And so good support person, not only will they take care of you and help, do the things that you may not be able to do, like drive you to your surgical appointments, drive you home, help you with your drain care, those kinds of things, but also somebody who is an emotional support to you. So that when you are experiencing the emotional roller coaster of surgery, they can bring you back down to reality and support you in a positive way.
Oh, I love that. Perfect. Um, how long have they been thinking about this? That plays into it, right? And then where, how how much time should they give themselves before calling?
So, most of the patients that I see have been thinking about surgery for a while because we hope that they are prepared mentally. They've thought through the support system. The other aspect, of course, with aesthetic surgeries, you have to determine how you're going to pay for it because aesthetic procedures are cash pay and are not covered by insurance. So, I think once all those things are in play, then you're ready for your consultation. I mean, and in addition to that, you have to understand what your goals are. If you have clear cut goals, and I think it's important to understand surgery will improve finite things that we can quantify. If you've got small breasts, it'll make them bigger. If you've got large breasts, we can make them smaller. If you have excess skin along your abdomen, we can remove that and do a tummy tuck. But it's not going to determine whether you can get that job or whether your boyfriend is going to propose to you, or it's not going to do those kinds of things. And so we have to understand what surgery is going to accomplish. And so I think that's another component. And once you have all those things in line, then you're ready to call for your consultation.
And so when they call, what is this benefit that they're getting by being able to sit down with you in a one-on-one versus Dr. Google and these months and years possibly that they've spent preparing for this moment? Now here they are getting to sit down with you.
Well, remember, Dr. Google is not scientifically vetted. Everything can be posted on the internet and found by Dr. Google. So when you meet with your surgeon, you're able to specifically tell me what your goals are and what you're hoping to achieve. And then I'm able to guide you and tailor a plan that'll help you get there. And if it's something that is not realistic or achievable, I'm able to let you know because I don't think we see that on the internet. One other component about preparing for surgery, which can occur after the consultation, is making sure you're nutritionally optimized. There's a lot of data that also suggests to have the best healing and recovery process after surgery, you need to have a high protein diet beforehand. And I typically advise patients that that should start 3 weeks before. And that's becoming even more critical in today's world because many of our patients are taking different weight loss medications, including the semaglutides and so on. And with those, if you're already in a state of where you're not eating enough because the medications are decreasing your appetite, you really need to make sure that your nutrition is optimized prior to surgery.
What does protein do for wound healing?
Protein is a critical component of wound healing. And it helps with collagen synthesis, which is how your scars heal. And so it's really important that we minimize the risks of having wound breakdowns, which is far more common in individuals who are malnourished. The other thing that can occur in individuals who are malnourished or who have low protein content is they may have fluid collections, or they may have prolonged seromas which can develop, or their drains may stay in place for an excess amount of time.
Okay, I'm convinced. Let's get the protein shakes going, okay? Let's get them going. So what about specific times of year for specific procedures?
In general, people think about having surgeries at different times of the year. So in the springtime, people are thinking about getting ready for the beach. And so you'll see a lot of individuals who are considering breast surgery. Mm-hmm. With body contouring procedures such as tummy tucks or liposuction, you frequently need to wear a compression garment, which can be kind of uncomfortable in our Oklahoma heat. So most individuals think of doing those surgeries in the fall and winter so that they can be ready for the summer and they don't have to wear a compression garment.
Yeah.
Other things
Plus you can see them like from your clothing.
That's true. If you're wearing shorts, they kind of show. Many individuals will consider facial procedures after the holidays so they can kind of hide out for a couple of months and nobody can see them. Mm-hmm. Sometimes people will think about doing, for example, liposuction of their neck in the wintertime because they can cover it up with a turtleneck.
Dual turtleneck, right? Yeah.
So those are kind of the components that play a role in when people consider certain types of procedures.
And that's all something that is helpful to guide them and just talk them through that strategy. We see it all the time, so we're able to say, like, from what I've seen, here are the things that we can guide you on. Now, summertime, industry-wide, not very popular for body contouring procedures, but it's not possible, right?
It's definitely possible, but you have to understand and be aware of what that means. For example, that means you're going to have a compression garment for 4 to 6 weeks because we want to make sure that we optimize your results. Or, for example, laser treatments are traditionally in the wintertime because we want to minimize sun exposure. Mm-hmm. But you can do them in the summer, but you have to acknowledge that you're going to be inside.
Yeah, you're going to have to do some more of that preparation. And these are, some people can't get around that. Teachers, students, this is their only time to do it. It's still possible. You just have to kind of plan. The days are longer, right? So doing a fractionated CO2 laser or the helium plasma laser for facial resurfacing, our days are a lot longer than they would be or than they will be in December, but it's not going to make you not a good candidate, but we have to make them promise.
Yes, you have to promise to follow doctor's orders.
Follow the doctor's orders. Additional thoughts on planning for surgery?
Planning for surgery. Well, the other thing you need to plan is, and this is what we've alluded to, is having the appropriate recovery time. You don't want to have surgery on Friday and then think you're going to go run a marathon on Monday.
Right.
Or, for example, for many surgeries, you have a weight limitation on your lifting. And so you don't want to have surgery on Wednesday and have to fly out of town the following Monday and carry your carry-on and put it in the bin overhead. That's not going to happen.
That's not going to happen. Yeah. Financially, are we planning, budgeting accordingly? Should we go ahead and make this consultation so we know how much it's going to cost, or be prepared before we come in the door?
So it's always helpful, obviously, since aesthetic treatments are cash pay, to have an approximate idea. We can't give you an exact cost without examining you because everything is unique to who you are. But it's fair to say that we have approximate ranges for most procedures. And when you call and you speak with Connie, she'll talk to you, get to know you, and try to give you a ballpark figure so that you can determine whether this is something that you're able to afford, because that is a critical component to ensuring the success of the procedure.
Yeah. And as far as preparation, we have great resources on our YouTube channel, on She TV YouTube channel, being able to watch different videos to gain information about the procedure specifically, what the downtime will be, what the recovery process looks like, what the incisions and scarring will look like, so that by the time you call, you're ready to have a productive conversation and create a good game plan. And we really appreciate that. But we love guiding. I mean, helping people make a good strategy to being able to get this accomplished is part of the fun too.
Mm-hmm.
Um, so when you're ready to start planning for surgery, use your resources, right? Check our vetted resources as far as scientifically based and board certified plastic surgeons. And give us a call when you're ready, and we'll talk you through the process, the timing, the cost approximation, and get scheduled. Thanks for watching. Now do me a favor, hit that like button and subscribe.